Hello everyone, and welcome back to Banana Life. Today, we're diving into a topic that affects millions of people worldwide: insomnia. Insomnia is a common sleep disorder that can make it hard to fall asleep, stay asleep, or cause you to wake up too early and not be able to get back to sleep. This can lead to a variety of issues, from feeling tired during the day to more serious health problems if left unmanaged. In this video, we'll explore the causes of insomnia, its effects on the body and mind, and a wide range of strategies to help manage and overcome it. So get comfortable, relax, and let's embark on this comprehensive journey together. First, let's understand what insomnia is. Insomnia is characterized by difficulty falling asleep, staying asleep, or waking up too early and being unable to return to sleep. It can be short-term, acute, or long-term, chronic. Acute insomnia can last from one night to a few weeks and is often triggered by stress or a traumatic event. Chronic insomnia, on the other hand, occurs at least 3 nights a week for 3 months or more. It can be caused by a variety of factors, including medical conditions, medications, and mental health issues. The symptoms of insomnia are varied and can significantly impact daily life. Common symptoms include difficulty falling asleep at night, waking up during the night, waking up too early, not feeling well rested after a night's sleep, daytime tiredness or sleepiness, irritability, depression or anxiety, difficulty paying attention, focusing on tasks, or remembering, increased errors or accidents, and ongoing worries about sleep. Understanding the root causes of insomnia is crucial to finding the right solution. There are numerous potential causes, which can be broadly categorized into lifestyle factors, psychological factors, medical conditions, and environmental factors. Lifestyle factors play a significant role in sleep quality. Poor sleep habits, such as irregular sleep schedules, stimulating activities before bed, or uncomfortable sleep environments, can contribute to insomnia. Consumption of stimulants such as caffeine or nicotine, particularly in the hours leading up to bedtime, can interfere with your ability to fall asleep. Alcohol, while it might make you feel sleepy initially, can disrupt sleep later in the night. Additionally, a lack of physical activity can contribute to poor sleep quality. Psychological factors, such as stress, anxiety, and depression, are common causes of insomnia. Stressful life events, such as job loss, divorce, or the death of a loved one, can lead to acute insomnia. Chronic stress, on the other hand, can lead to long-term sleep issues. Anxiety disorders and depression can also disrupt sleep patterns, making it difficult to fall asleep or stay asleep. Medical conditions and medications can also lead to insomnia. Conditions such as chronic pain, asthma, diabetes, and heart disease can interfere with sleep. Certain medications, including those used to treat allergies, depression, high blood pressure, and asthma, can also cause insomnia as a side effect. Additionally, sleep disorders such as sleep apnea and restless legs syndrome can disrupt sleep and lead to insomnia. Environmental factors, such as noise, light, and temperature, can also impact sleep quality. A noisy or brightly lit bedroom can make it difficult to fall asleep. Similarly, an environment that is too hot or too cold can interfere with your ability to get a good night's sleep. Now that we've covered the causes of insomnia, let's explore its effects on the body and mind. Insomnia can take a significant toll on physical and mental health. Short-term effects include fatigue, irritability, and difficulty concentrating. Chronic insomnia, however, can lead to more serious health problems. It increases the risk of developing conditions such as hypertension, heart disease, diabetes, and obesity. Insomnia can also weaken the immune system, making you more susceptible to infections. Moreover, chronic insomnia is associated with an increased risk of mental health disorders such as depression and anxiety. Given the serious impact of insomnia on health and well-being, it's essential to find effective strategies to manage and overcome it. There are a variety of approaches to treating insomnia, including lifestyle changes, behavioral therapies, and medications. The best approach often involves a combination of these strategies tailored to an individual's specific needs. One of the most effective ways to combat insomnia is to make changes to your lifestyle and sleep habits. Establishing a regular sleep schedule is crucial. Going to bed and waking up at the same time every day helps regulate your body's internal clock and can improve the consistency of your sleep. Creating a relaxing bedtime routine can also signal to your body that it's time to wind down. This might include activities such as reading a book, taking a warm bath, or practicing relaxation techniques like deep breathing or meditation. Creating a sleep-friendly environment is another important step. Make sure your bedroom is conducive to sleep by keeping it cool, dark, and quiet. Consider using blackout curtains, earplugs, or a white noise machine if necessary. Investing in a comfortable mattress and pillows can also make a significant difference in your sleep quality. Limiting exposure to screens before bed is also important. The blue light emitted by phones, tablets, computers, and TVs can interfere with your body's production of melatonin, a hormone that regulates sleep. Try to avoid screens for at least an hour before bed. Instead, engage in relaxing activities that don't involve screens. Regular physical activity can also help improve sleep quality. Exercise helps regulate your body's natural sleep-wake cycle and can reduce symptoms of insomnia. However, it's important to time your workouts appropriately. Exercising too close to bedtime can actually interfere with sleep. Aim to finish exercising at least a few hours before you plan to go to bed. Diet also plays a role in sleep quality. Avoid large meals, caffeine, and alcohol close to bedtime. Caffeine and nicotine are stimulants that can interfere with your ability to fall asleep, while alcohol, although it might initially make you feel sleepy, can disrupt your sleep later in the night. Instead, opt for light snacks that are easy to digest if you're hungry before bed. Behavioral therapies are another effective approach to treating insomnia. Cognitive behavioral therapy for insomnia, CBTI, is considered the gold standard treatment for chronic insomnia. CBTI addresses the thoughts and behaviors that contribute to insomnia and helps develop healthier sleep habits. This therapy involves techniques such as sleep restriction, stimulus control, and cognitive restructuring. Sleep restriction involves limiting the amount of time you spend in bed to the amount of time you are actually asleep. This helps to build a stronger association between your bed and sleep. Gradually, as your sleep improves, the amount of time you spend in bed is increased. Stimulus control involves creating a strong connection between your bed and sleep. This means using your bed only for sleep and sex, and getting out of bed if you can't sleep after about 20 minutes. Doing something relaxing in another room until you feel sleepy can help reinforce this connection. Cognitive restructuring involves identifying and challenging unhelpful thoughts and beliefs about sleep. For example, if you find yourself worrying about not getting enough sleep, cognitive restructuring can help you develop more balanced and realistic thoughts about your sleep patterns and needs. In some cases, medications may be prescribed to help manage insomnia. These can include over-the-counter sleep aids, prescription medications, and natural supplements. Over-the-counter sleep aids often contain antihistamines, which can make you drowsy. However, these are generally not recommended for long-term use as they can cause side effects and may not address the underlying cause of insomnia. Prescription medications for insomnia, such as benzodiazepines, non-benzodiazepines hypnotics, and certain antidepressants, can be effective for short-term use. However, they also come with potential side effects and the risk of dependence, so they should be used under the guidance of a healthcare provider. Natural supplements, such as melatonin, valerian root, and chamomile, are also commonly used to help with sleep. Melatonin is a hormone that regulates sleep-wake cycles and can be helpful for short-term sleep problems or for adjusting to a new time zone. Valerian root and chamomile are herbal supplements that have been used traditionally to promote relaxation and improve sleep. In addition to these strategies, managing stress and anxiety is crucial for improving sleep. Techniques such as mindfulness, meditation, and yoga can help reduce stress and promote relaxation. Mindfulness involves focusing on the present moment and accepting it without judgment. This can help reduce the racing thoughts and worries that often contribute to insomnia. Meditation involves various techniques to focus and calm the mind, which can help reduce stress and improve sleep. Yoga combines physical postures, breathing exercises, and meditation to promote relaxation and reduce stress. Another important aspect of managing insomnia is to avoid looking at the clock. Constantly checking the time can increase anxiety about not being able to sleep, which can make it even harder to fall asleep. Turn the clock away from you or put it in a drawer to avoid the temptation to check the time. If you continue to struggle with insomnia despite trying these strategies, it may be helpful to seek professional help. A healthcare provider can help identify any underlying medical conditions or medications that might be contributing to your sleep problems. They can also refer you to a sleep specialist or a therapist trained in CBTI for further evaluation and treatment. In conclusion, insomnia is a common but treatable condition that can have a significant impact on health and quality of life. By understanding the causes of insomnia and implementing a variety of strategies, you can improve your sleep and overall well-being. Thank you for joining me on Banana Life today, and I hope you found this information helpful and informative. Take care of your health and see you in the next video.